for. 40 days, the standard definition of quarantine, has just been completed. We have a couple of more days as the government very kindly alerted us, today being a holiday and the next 2 days being over the weekend, we get it extended over till Monday. And hopefully, depending on which color-coded district you are in, red, orange, or green, you will be able to get to some level of normalcy. What is this normalcy? What has changed over the last 6 weeks? What has changed over the last 90 days for India, indeed for the whole world, is something that we will continue to wrap our heads around in the weeks, months, and years to come. But life continues on, and the everyday activities, everyday necessities happen, and they need to be coped with. We have coped, and we need to cope as we go forward. Helping us along the way have been experts, have been leaders from society and respective fields who have joined us in these afternoon conversations to be able to help us understand, make sense of, and adapt to the situations ahead. And this afternoon, like before, we have a stunning array of experts, leaders who will work with us as we talk and as we try and wrap our heads around what lies ahead. I want to thank each one of our panelists who have joined us. Some of you will stay on for the whole 120 minutes. Some of you will drop off at the 40-minute mark, and others will join in and we'll continue the conversation along. My name is Bobby John, and it'll be my privilege to string this conversation together. It is sometimes easier and equally hard to do virtual conversations because there are no set changes of chairs or of the podiums. People will come, people will stay on, and we have to figure how to continue the conversation on. Without taking any more of your time, let me turn to each of the distinguished panelists that we have on our stage. And I want to start with Dr. Vivek Bindra. For the many, many people who have followed this motivational speaker, this leader, trainer, he needs no introduction. But for those that haven't, Dr. Vivek Bindra leads Bada business. He is a motivational speaker and trainer and enables companies and leaders to adapt and devise strategies as to how companies and corporates can address the needs, address the challenges, and address the opportunities that are out there. Thank you so much for joining us, Dr. Bindra. We have with us Dr. Shuchin Bajaj from the Ujala Sygnus Hospital Group. He's a founder director with nearly a dozen hospitals in Northern India. We are grateful that you have taken time out of your clinical practice to be able to join us and be part of this conversation. Dr. Dharmender Nagar, the lead for the Paresh Group of Hospitals, again, with an equally big footprint across multiple states in Northern India, serving in Tier 2 and beyond districts where the action really is. Thank you so much, Dr. Nagar, for being part of our panel and for sharing the experiences that we will want to hear from as to how India is managing to address the current pandemic challenge. Mr. Vivek Tiwari, thank you so much for joining us. You are the CEO of Medica Bazaar at a time when medicines seem to be the business to be in, but physical distancing norms means that you can't actually crowd the pharmacy. You have been among the people figuring out how to deliver both everyday and life-saving medicines to the many people in different parts of the country on time, reliably. And that has been something that we have both learned as an adaptation and will need to see how we utilize as we go forward. Thank you so much for joining. From a large conglomerate, but with a medical background, we have Mr. Paresh Chaudhry, the brand custodian for the Adani Foundation. You have pharmaceuticals in your background. You are today in a multi-dimensional group with many, many interests across industry spaces. We'll hear from you in terms of how our economic and our overall engagement in the employment space and what it translates to for our population at both the grassroots levels and at the overall conglomerate level, how the economy will do and what adaptations we need to have. Without wasting any much more time, I also want to kind of introduce to you my colleague and founder of the IHW Council, Kamal Narayan, CEO at the IHW Council, who will also be participating in this conversation and will stay right through along with me. Thank you so much. For those of you on our Facebook Live audience, keep your questions coming in. Our team will filter them back into us so that we can direct them appropriately to each of our esteemed guests. Let me start with Dr. Bindra. Thank you for making your time and being with us. Everybody uses the word unprecedented, enough to have made it so common. What is so unprecedented about the last 90 days in India and about 180 days for the world? And where do you see us going beyond this unprecedented moment? What lies ahead?
So what lies ahead is, I say 3 words: adaptability, adaptability, adaptability. This is a time of readjustment, alignment of the full teams with the new plans. This is a time customer aapke bina apne aap kabhi kar bhi na paaye. So right now, focus on your data. Networking is oxygen for you. Engage with the local media to actually build up your right positioning. Improve the imperfection of your existing competition. Focus and understand what has been your competitor offering till now. How do you improve the imperfection of the innovation of your competition? I'll say that again, it's a little complicated. How do you improve the imperfection of innovation developed by your competition? What has your competition done and what are the existing imperfections in your competition? If you can focus on the improvisation of his imperfection, that will be better than his innovation. Then focus on service dimensions. If you're not able to sell right now, this is the time to start servicing your existing client base. Now, a new time will come on sales and delivery innovation. The delivery innovations will change. Even during lockdown, post-lockdown. What is going to be the new strategy for your distribution network? Find out reasons how will your customer switch and will come back to you. He will leave other competition. And then I can go on and on, Doctor, if you can let me know if
right. No, so thanks for setting the stage. I kind of get it why you have such a large following, both on social media and otherwise. You have a phraseology and a way of putting things together that are like mantras. So I get some, and I'll have to kind of unpack some of that, both for myself and for along with our rest of our colleagues. But the first thing that I want to kind of pick up, and I want to kind of then turn around to both Mr. Chaudhry and to Mr. Tiwari, is this. Adaptation is what you've kind of called for. Adaptability to a changed risk environment. Clearly, things have quite dramatically changed. Understanding the changed risk framework and restructuring yourself to be able to respond and having a roadmap stroke runway. Let me start with Mr. Chaudhry, because you have a much broader remit, and then I'll kind of drill down to one specific business area with Mr. Tiwari. I mean, broadly, where do you take what Dr. Bindra has said, and how do you see India Inc. Adapting to the revised risk framework, and what kind of roadmaps and runways are you seeing ahead?
Thanks, Bobby. You had a 7-minute long, nice introduction to our panelists. So thanks, Kamal, for inviting me, and I'm glad that I could be amongst you guys. I think Vivek's talk has been. So I'll move away from a little bit of the theory part, right? I think let's focus on how India Inc., if you look at the context from the world and the global, why we are still very successful, why the Indians working abroad and at every single sector are far more smarter than any other race in the world, is because I think from the time we were born to the time we go to school and college and everything else, I think there's something very grained into our system is being proactive. Our red flags go up the minute I see red or I see green. So having said that, if the companies have to now talk about adaptability at this time of this so-called crisis, then I think they need not be in business. They need not be what they are doing in life, right? So I'm saying from an entrepreneurial small company to a mid-sized company to a large companies like, and Bobby, I head the entire brand custodian for the Adani group, and the foundation is also a part of that. I had a similar role with Mukesh Ambani earlier, and I spent a lot of time with Hindustan Lever and Unilever globally. So adaptability is something which is ingrained into the management systems of organizations. And largely it's true with the listed companies and also with the private ones. I'll just give two key messages. The impact of the lockdown and the impact of, oh my God, this is going to be a little more than what I thought, was felt only when the Prime Minister announced on the 14th of April, right? Before that, it was a lockdown. Yes, virus was spreading and we're not taking it very seriously. That's when I think people started saying, okay, now what do I do next? A lot of organizations, small, especially I'm talking about the smaller ones. I'm not even talking about the ones on daily wages. There's a separate segment which my heart goes out for, and I think government is trying to do something around that. A lot of NGOs, a lot of communities are reaching out to feed them and to take care of the basic needs. But I'm talking about organizations, small and big, especially small and new. These guys, I think, have to make sure that they stand by their shareholders and their stakeholders, especially their employees, their partners and the vendors. This, to me, Bobby, is the test of your character. It is not about theory and management jargons of vulnerability studies and risk assessments. And I mean, if you've not done in the past, then you don't need to be in business, or you need to run organizations. Okay, then you should just go and maybe start some business of your own. But I think this is a time of character. You cannot let go of the people. You can have cost cuttings. I mean, in the last 4 weeks, we have done the whole restructuring. We've looked at a lot of ways going forward and where the abnormal times of post-COVID will be and not the normal ones. What is it that we should do? And I don't think companies are taking some great, huge steps of saying, now I will get technology in and I will get innovation in and I will do. This is the time that they will do things that they should have done many, many years ago. For example, cutting cost and travel. For example, making sure that your innovation and technology, which is in the forward footprint and the backward footprint for consumers and with your supply chain, has to be efficiently run. Now, these are elements that have been taught in management schools and practiced in organizations for the last 2 or 3 decades. But this is the only time, Bobby, that I can tell you where you cannot let go of your partners and your employees. There could be certain short-term, small blip, and depends upon how small the organization is and in which space you are. For example, the airports, the airlines, the restaurants business, the Ola, the Uber. There's no business happening right now, right? Nothing. And therefore, you'll have to consider how. But are you telling me that people, SMEs or MSMEs, who've been in the industry for like 10 years and 20 years and 3 decades, cannot sustain for 3 months, can't sustain to look after the people for 2 or 3 months of a blip when your people need you the most? So I think time has come to show character. Number one, to restructure to a certain extent that you show the way of saying, okay, I will do this for the next 5 years, not because of COVID, but I will do this because it improves my management practices, it improves my efficiency and productivity, and I get more profitability in the future. This is the time to reach out to your customer, existing customer, and to all your stakeholders. I can tell you that the GDP growth for this year will be anything between 1 and 2. Some people are saying even negative growth. But I'm a born optimist. Everything will come back to normal. And this is not going to take 2-3 years. To me, I'm looking at 2 or 3 quarters. The so-called W that people are talking about, the W will land up by November 15th or 30th. By December, Jan, you will see a completely V-shaped a rebound coming back, not just markets, in terms of jobs, in terms of the economy moving forward, etc., etc. So these 2-3 things that I wanted to mention, Bobby, in my earliest. I've got a few other points that I will talk about. But last point is, this is the time to do a lot of citizen communication and not consumer communication. And for obvious reasons, because citizens are more loyal to you than consumers are. Consumer loyalty today is 0. Thanks, Bobby.
Right. So something that connects both what Dr. Bindra said and Mr. Chaudhry said, and I want to kind of put that together and then pick on something else that you said, which I want to highlight for our audience. This is the moment for communication. I think what Dr. Bindra said, communicate extensively. But the nuance that you brought in, Mr. Chaudhry, is this, that you need to communicate not to a consumer, but to your colleagues, to the citizenship, to the partnership ecosystem that you have. And this is the time for a test of character, not a time for merely being opportunistic, but to showing out what you're truly made of, what your character is made of, and what you really live by and stand for. If the business is what you've lived by, and if the people have stood with you for so long, this is the moment to stand by and to make sure that you are continuing to exhibit the same resolve and character that you started your enterprise with. You may have started it 3 months ago. It's always harder at that point in time. 3 decades ago, you have no excuse right now to say, these are tough times. These are tough times universally, and we all need to carry each other together. And so that's where I kind of then drill from the biggest thing. And then thank you for also pointing out that optimistic thing, that you would see the fourth quarter of 2021 as something where we might see a very different scenario. 2021 holds, let's put it this way, a brighter new year than what we probably imagined right now. And so with that, I want to kind of turn to Tiwari. If you had not prepared, this is not the moment for innovation. So clearly, America did not come about over the last couple of months. You've been in this business for a while, but you've suddenly found yourself at a point where you can come into your own. How do you take the comments both of adaptability and of being there, and now coming into, let's put it this way, in your own elements at this point in time of crisis?
Thank you, Dr. John. So it was nice hearing to Mr. Paresh Chaudhry and Mr. Vivek Bindra. Before I start talking about it, let me just give you a right description of what I do. So that will even give you a better perspective of our business. So Medica Bazaar is essentially the largest B2B portal of medical supplies. When we call B2B, essentially we reach out to all tier 2, 3 locations in the country. We cater to more than 45,000 medical centers. We cater to 100,000 plus doctors. So we empower and enable medical care and not just reach out to consumers. So it's a pioneering venture we started 5 years back. Now coming back to your topic. So let me start with a quote. So we are in the midst of this storm of Corona because we are in medical supplies for last 3 months, not just when India started this episode, but actually when it started in China, and many Chinese buyers reached out to me, and we supplied to a lot of Chinese conglomerates that point in time because there was acute shortage there. And I remember a quote given by Mr. Jack Ma that point in time in China, and I'm being acute optimistic like Mr. Paresh Chaudhry said that. So he gave that first quote, and you can find that relevance somewhere in media, that 2020 is the year for staying alive for businesses. Don't think about your dreams or about vision. If you have stayed alive in 2020, you have made your profit. That was the level of dissatisfaction built up in Chinese business way back in just January, February. And today, see, China has completely rebounded back, and they are now supplying to entire world. That's the kind of optimism I would say we should live in. Now, coming from our company, our industry perspective, so we are part of, say, 4 industries or 4 sectors per se within one company. So when we talk about when we talk about healthcare, so healthcare, obviously, where we are in the midst of what's happening today with engagement of buyers, with a lot of engagement of sellers, with engagement of our customers. In fact, one of our esteemed customers, Mr. Dharminder Nagar from Paras Hospital is here. Mr. Shuchin Bajaj is here. They have been actively engaging with us. So when we talk about customers, I think, yes, customers' empathy, customers' trust and relationship is the key. We have to live and we have to sail through with our customers. Similarly, like with buyers and similarly, like with our manufacturers or what we call a seller ecosystem, we have to be partnering with them. We have to live with them. We have to show empathy to them. So this is the time of hand-holding and being together. That's what we have been doing. Now, coming over to the other sector, which is essentially the e-commerce sector. If you talk about largely the e-commerce, barring few sectors in e-commerce like medical supplies or typically the so-called delivery medicines, as you said, like companies, there are many companies doing that. So e-commerce has been primarily into deep distress because of the challenges of essential, non-essential and all that. So obviously there has been huge setback for e-commerce sector, especially companies like Flipkart, Amazon had been under huge pressure to retain people. Certain part of e-commerce sector like Swiggy, Zomato have actually fallen into a deep trouble. Oyo, for example, has been laying off a lot of workers. So I don't know whether this is the right strategy for them or whether they are looking at continuity model like this. Now coming over to the third sector where we represent is the logistics and supply chain. We have seen what happened in last 30 to 45 days in India. The lockdown decision was taken hastily. The essential, non-essential differentiation was not done properly. So there has been a huge disruption, the way supply chain was happening and the way the local authorities were not allowing people to move. We had seen huge challenges and problems in the way movement of essential supplies were happening. At a point in time, I can tell you from Delhi, it took 11 days for a vehicle to reach Bengaluru. It's our own fleet. 11 days for a vehicle to reach Bengaluru, and that's the level of problems we were facing. Now situation has normalized. Obviously, there's been a lot of thinking, a lot of industry support which has gone into logistics and supply chain. And lastly, the startup ecosystem. I think as a startup, we always live in the world of risk. We always live in the world of whether there is a probability of getting success or there is a probability of being failed. So we all know how to get risk mitigated. We all find ways to mitigate those risks, and we all are looking at innovative steps to model our business so as we continue in the future. Many startups which have started doing something during earlier times have now completely turned back and become something as a different large business entities. The classic example I would take is Paytm. Paytm has started as a recharge terminal. Now it's one of the largest payment ecosystem. So obviously, as a startups, we live in those risk-taking abilities. We live in those abilities to innovate ourselves and look at businesses which could adapt to the present ecosystem and obviously live to change our model to live by that. Right. These are few comments which I wanted to make. Thank you.
So thanks, Mr. Tiwari, because just as for our audience, we are just about the 30-minute mark. What we are getting is the sense that this has been a moment where companies have come forward to show their colors of their character, of their partnership with the entire ecosystem, both with their employees, their partners, with the customers, and all the while adapting to the rapidly changing scenarios, most of which is acutely felt, which is where I turn to Dr. Nagar, at the hospital level, both of a heightened expectation that hospitals will be both under stress, and at the same time, you also having to struggle with how do you get your entire act together? Do you have assured supplies? How do you protect your people? And how do you actually deliver the kind of care that everybody's expecting you to deliver, at the same time being able to float above water? What has been the situation for you? Just give us a sense of what your operations are like at Paras hospitals, and this help us understand that before I turn to Dr. Bindra.
Hi, good afternoon, everyone. I think we all acknowledge this is deeply challenging times. All of us are challenged in different ways, regardless of our businesses. Most of the challenges for all of us remain the same. How do we continue our businesses? How do we keep our employees engaged? How do we keep retaining them while serving our customers, in our case, our patients? The situation has been quite dynamic and quite varied across the regions. We have one of our hospitals in Jharkhand, in Ranchi, which is now a COVID hospital purely for COVID. So that has been taken over by the government, and we are quite happy to collaborate with them. I'm not very sure that we're going to get any money out of them or anything is going to come out of that. There is a foregone revenue loss, but at this time of crisis, we are happy to participate. Similar thing had happened with Panchkula, but other hospitals also came across and said, we'll also participate. So across other hospitals, we've kept roughly 25% of our beds for COVID patients, and rest of the beds are available, although hardly being used. There is very, very low footfall in outpatients. People are afraid to come. Some of them can't come. Some of them have great trouble coming. And we've also seen in our emergencies few cases of delayed arrival of patients, which has actually also cost lives, not with COVID, but with cardiac arrests, with other serious illnesses. In this challenging time, we all have to be optimists, but I think first we have to be realists. In the medium term, long term, everything looks better, will recover, will become great. As they say, in the long term, we all are dead. So we'll all have to survive the short term to arrive at the medium and the long term. Prime Minister was proactive in locking down, and I think it was the right strategy. The strategy now is more political, social, economic rather than healthcare strategy. Because essentially, as a percentage per million, the number of patients being affected by COVID and the deaths are minuscule relative to how many deaths happen generally in any ways in influenzas and other viral infections across the region, in India particularly. So if you look at the whole picture, the conversation now is more to do with how do we open up? How do we open it up in a planned manner where economic activity comes back on stream?
Right.
Coming back to our own particular case, the challenges are so varied that every district authority is making its own decisions. So lockdown may be national, but the actions are so local, so varied.
Right. We seem to have a little bit of a difficulty with Dr. Naga's connection here. So this is where I'll turn to Dr. Bindra before I come to Dr. Shuchin Bajaj to kind of amplify on where specifically the hospital-related issues might be. Dr. Bindra, I mean, you've heard right now from multiple perspectives, including drilling down to a hospital-like situation. You started off with adaptability. Where is it that you want to kind of leave us off? Because I know that you are also kind of dropping off this panel shortly. Where do you want us to kind of keep our thoughts on?
See, business continuity plan is important. My area of focus in my next conversation, since you've asked me where do I want to drive this conversation, your manpower can make you superpower. Now, if you look at TCS has briskly moved 90% of its about 350,000 employees post-lockdown into a new operating model, which is called secure borderless workspaces. Secure borderless workspaces means they'll be engaging their manpower from home. This work from home will continue for them for next 2 years. If you look at a budding entrepreneur or a small-time entrepreneur, unlike Mr. Paresh said, that the entrepreneur which has been working for 2 or 3 decades, but let's look at somebody. I'll also add upon looking at somebody who started his business in the last few years. And let's say if his cash flow is really drained, he's got highest character. But what to do now? He has to really engage his manpower. He has to really focus on new ways of building work from home strategies. He needs those tools and frameworks. The tools and frameworks required are those, because a small-time entrepreneur in India may not have an understanding of what are those regular templates and documents, the frameworks and the calendars of communication, the follow-up and checklist. There are basic templates of every follow-up and checklist. So if you can start creating them, those strategy sheets, those policy documents, the new agreement, the tracker sheet, the feedback forms, the questionnaires, or let's say the technology tools, CRM tools, ERP tools, video conferencing tools, project management tools, calling conferencing tools, collaboration tools, employee efficiency tools, accounting tools, they will help. So with which you can then demand commitment from your team, and you can plan well and define the role clarity and goal clarity with timelines and document of completion of work with every individual employee.
Sure.
If you can encourage your team to take scheduled breaks, of course, they can't be available all the time. Then don't assume things. If you've got to give feedback, give it privately. If you've got to appreciate, do it publicly. Start appreciating things. Don't sit back and wait for responses. Remind and seek for updates when you're working. Of course, you don't need to do micromanagement. Now, at the strategy level, when you work from home, you've got to integrate few departments, delegate few things, eliminate things which was not needed, automate by building right technology, and liberate by outsourcing. So I said integration, delegation, elimination, automation, and liberation. When you're working rituals for home, you should focus on 4 things every day. Every morning, what was planned. Every evening, what got completed, what got delayed, and what was carried forward. Documentation is important both for performer and non-performer, because if you document the performer, you can appreciate him at the right time. If you document the non-performer, like Mr. Bill Gates says, always keep removing the 10% bottom of your pyramid in your organization who are absolutely behaving like parasites. When you're managing meetings from home, you've got to be in listening mode. Pause it sometimes. Those listening capability, becoming a listening, then the minutes of meeting will be captured, will be much better. How do you engage the team at their highest? By celebrating every small win, by doing those group chats, meetings, and giving one-to-one right feedbacks. See, people are not lazy. They lack 2 things. 1, the clarity. 2, the energy. I'll say it one more time. People are not lazy. They lack 2 things. 1, clarity. 2, energy. See, execution is everything. People now, no investor is going to give money for ideas. They'll give you money for execution. तो अपने प्रोफेशनल्स को परिवार बनाइए, परिवार को ट्रेनिंग देके प्रोफेशनल बनाइए, प्रोफेशनल को प्रेम देकर के परिवार बनाइए. This is how you can actually do it. Thank you.
Right. So I mean, absolutely brilliant, and there are a bunch of mantras there. But when I kind of whipsaw to you, Dr. Bajaj, at your dozen odd hospitals, there's no luxury of work from home. Your people, all of you, have to be at the front line. Your evaluation, your performance metrics, everybody, I mean, whether it's you or whether it's Dr. Kapoor's hospitals or whether it's the Paresh hospitals, your evaluation, your metrics are all at this point in time in many ways blurred. How are you kind of managing? What is the coping mechanism, and what is it that, how are you kind of adapting to kind of go back to an earlier mantra that was said? What's happening at the hospital level? And I want to come, I'll then kind of flip back to Dr. Nagar, who got cut off, and then introduce the others who have joined us. Dr. Bajaj.
Thank you, Bobby. Warm greetings to all of you. And let me start off by giving warm greetings for the Labor Day today. And we should be remembering all the workforce that has been working for us, that's, I think, either stuck on the way or stuck at their workplaces or stuck at home and not being able to come back. So let's spend a minute to pay a tribute to them and thank them for their work that they have been giving us for the last 10 or 12 years that we've been there, and for the last hundreds of years that industry has been there. And since we're speaking of Labor Day, I think the first name that comes to mind in that is Lenin. And I think one of his sayings is the most appropriate sayings that he ever made. He made a lot of statements that I don't agree with. But I think the fact that he said that there are decades when nothing happens, and then there are weeks when decades happen. So these are some of the weeks that we've been seeing that decades are happening very quickly. We've been hearing to so many accomplished speakers here, and points well taken, all of them. We need to adapt, as Dr. Bindra said, adaptability is the key of the hour. we need to change, we need to learn. But as you said, in hospitals, what do you do, right? Healthcare industry does not lend itself to all these changes very quickly. We are like the Titanic. We are too big. We can see the iceberg right in front of us, but we can't really change course immediately like a speedboat. So the fact is that you become a heroic leader immediately. There are benefits of delegating, and there are benefits of post-heroic leadership, and allow people to work with freedom. But crisis calls for totally heroic leadership. You have to jump in, you have to lead by example. This is code red, so plug everything. Revenue leakages, pause leakages, even to the extent of ensuring that they switch off each and every light when it is not needed. You have to drill down to that level. What is the diesel being used? What are the needles being used? What are the syringes being used? Because as Vivek also said, this is the time to just survive. You don't want to die, because Dr. Nagar said everything will be good in the long term, but then you need to be there in the long term. You need to be alive to take advantage of all those good things. So I'm working like 16 hours a day. My family is flabbergasted, saying, what is this lockdown? You're working all the time. What is happening? I mean, is it just an excuse to get rid of us? Or is it really the work that's driving you? So we are working morning 7 o'clock our call started. We are working through the day into the night. So you have to keep your staff motivated. There's not enough PPE. You have to tell them that, their concerns are at the top of your mind. So we are living through extraordinary times for sure. Perhaps we did not choose these times, but we do get to choose how we live through these times. So we have to modulate our responses. We have to take everyone together. We do not have the luxury of working from home or cutting down on salaries or cutting down on staff. We have to be super ready for the expected deluge that's coming in. Problem, it's still expected deluge. There are no patients in the hospitals for sure. The best of hospitals are showing at least a 50% revenue fall. There are no OPDs, there are no electives. Everybody is postponing their surgeries as much as possible. And as Dr. Nagar said, some of the emergencies also are finding it difficult to reach the hospitals. Our medical tourism business is zero, absolutely. So all these things push you to think at new things. So a lot of things we are trying to innovate on. We managed to start our teleconsultation platform in 2 days flat. We had been thinking of doing that for the last 7-8 years and never actually got down to it. But when push came to shove, you started it in 2 days. So as Reid Hoffman said, entrepreneurs are people who jump off the cliff and build parachutes on the way down. So we actually haven't jumped. Somebody has pushed us off the cliff. We're trying to make the parachute as quickly as possible. It is tough times, of course, but I hope we will all survive and get through this, and then have stories to exchange over a drink when we meet in next year or so.
Right. And thank you so much, Dr. Shuchin, because that's absolutely pretty much the front end of where this crisis is. And like I said, there's an expected deluge. As you're waiting for it, you also see that your current revenue lines are also kind of strained. Is it the same, Dr. Nagar, at the Paras group of hospitals? And how are you kind of seeing that? Sorry that you got cut off earlier on.
Apologies for that. We are pretty much, all of us are in the same position. I think as an industry, our estimate is that private healthcare industry is going to lose this month, in April, the last month, we would have lost 7,000 crores. If this continues, this would turn into 14,000 crores and 21,000 crores in the first quarter. So everybody is facing this challenge. And the challenge is twofold. Some of our costs are increasing because we have to do extra cost in PPEs, manpower, shifts. All of these costs are adding up, yet at the same time, the patients are not there. The planned surgeries are completely blocked. So it's a very critical situation for all of us in private healthcare. At the same time, at least I'm glad in a way that people are recognizing the essence and the essentialness of healthcare, which was completely lost because of our own actions, and in society in general had lost respect for healthcare professionals. And I think everybody in the world has recognized film stars, movie stars, sports stars, all the stars are at home. The only stars who are out there saving lives are healthcare professionals. And I think this has truly shown the great work we healthcare professionals do. I hope that this great work and claps and talis get converted into action by the government, which had been very dismissive, very antagonistic of private healthcare. Hopefully that goes away. It becomes a collaborative partnership as it is right now. We are happy to participate. We are there. We are giving up our facilities, our revenues for sake of saving lives. And I hope that the government realizes that private or public healthcare, we are in it together to save lives. And I hope that they understand that in coming weeks, months, they give us our own credit and make our policies easier so that in the future, we can come over the shock and create a better healthcare system for everyone in the country.
Thanks, Dr. Nagar. Honest words there in terms of both the claps are there, but it needs to also be substantiated with a lot more of action. That's how I kind of read or hear your last few lines there. We're joined by a few more colleagues here on the screen. We have Ranganathan, we have Savitha Kuttan, we have Radha Rangarajan, we have Anshu Gupta, and we have Rajesh Aggarwal. I'll come to each of you, but let me kind of start with Dr. Atul Kapoor. And those that are there from before, I will come back to larger points being made, drawing out from what the specific hospital and healthcare industry folks are saying for your comments. But let me turn to Dr. Atul Kapoor from Regency Hospitals. Sir, thank you so much for joining us. We've heard from Dr. Shuchin Bajaj from Sygnus Hospitals. We've heard from the Paresh group of hospitals, from the Regency group of hospitals, and you've run hospitals inside UP. You're primarily focused in Uttar Pradesh, I believe. What is it that your experience is? How have the last 6 weeks been, and what is it that you're kind of responding with?
Thank you, Bobby. Can you hear me?
Yes, sir.
Yeah. So, well, we are no different from what others have said just now. The scenario is same all over the country. Anyway, low patient footfalls, no OPDs, low occupancy, and besides that, general scare in the staff, general scare in the doctors. Initially, and so basically we were going through really tough times. And as Dr. Bajaj said, that we were already working on this, reducing our cost for us 3 to 6 months. So we had a lot of work being done. We had some professionals to do the job to bring our EBITDA up and cut the cost in sub level. So we had been doing the last 6 to 8 months, and these 6 weeks has taught us that, as Dr. Bajaj said, you switch off the lights, you do so many things, which are basically now important to survive. Fortunately, you see that as said earlier, that every district, every state has a different view. So then what happens that if I have to do something, then I have to have the district administration with me. And fortunately, we have 5 hospitals in Kanpur. So at some level, the district administration requires us from time to time for the last 25 years. So that way, we are able to take support from them at various positions. Times are tough, really tough. And I think what has happened, that initial shock was tremendous, that for first 1 week, doctors stayed at home, the staff stayed at home, it's a lockdown, nobody's coming. Then gradually, what I did was that, just not 16 hours, but 13, 14 hours, I was at the forefront, sitting in the hospital and trying to tell people, doctors to come, I am there, don't worry. And, donning the mask and being there at every place, roaming all over the hospitals, so that people feel that, yes, the CEO is there to take care of them. The good part was that my staff was really cooperative. Because, I've got people working for the last 20, 25 years. So there's a history with the organization. And some new people also. But they were very cooperative in the sense that, many times my doctors themselves, scared to come. But all the staff, they came on time. They came in on duty. They came to work. So that was the good part. And then I felt happy that, look, these young people who are drawing salary 30,000, 40,000 rupees are there at the forefront. Okay, whatever you say, we'll do. At one point of time, the government said, you make a COVID setup. So I was quite enthusiastic. Okay, we'll make a COVID setup. Out of my 5 hospitals, 1 hospital I'll convert into COVID facility. Then the guidelines came, no, you'll not do that. And COVID be done by the government only. See, every day new ideas are coming. Every day the government Ministry of Health and Family Welfare gives a new, circular, new guideline. Everything is so confused. But at that point of time, So we thought we make just an example, we made a COVID ICU. And you will not imagine that about 50, 70 nurses from my hospital, there are 500 of them now in Kanpur. They came forward, sir, I will do something for the country. Please take me in the corona ward. So that gave me so much, courage. And I told my doctors, look, what you are doing and what these girls are doing. See, they are saying they will work for the country. And so that, that is a good part about the whole story. But then again, now what has happened in the last 4 or 6 weeks? Every week, there has been some improvement at some place. Means that initial week of shock, then second week, some people trundled in, and the third week, something more. And last 1 week, I've seen, the media plays a big role in making the positivity around us. So the last 4 days, media is saying, no, we are 25% recovery, and we got 0.37% in ICU only, and everybody's fine, and people are getting fine. No, so that moves the psyche of the people. So I'm seeing that to come to normal, I think it'll take up to September when we really have our own normal business that it was. But I feel that, the new normal would be about 15 to 20% lower than what it was last year. But again, going forward, I think our industry, you see the bright side. Our industry is the only industry where something is strictly in. Think of industries where nothing is working. Look at the airline industry, the railways, the restaurant industry, the hospitality, the hotels are closed. So why should see the brighter side? The brighter side is that at least 15% revenue is there, 20% is there, 25% is there. So at least something is coming forward. And as we said, that the society recognizes you, that look, these are the people who will take care of you if you have any problem. And suddenly I have so many friends in the city, was calling me that, how are you? Are you fine? They never called me earlier. So then they want to be on the right side of doctors. So that's a good feeling I have. Business apart, you see, some things are not in my control. Some things are not in anybody's control. You take a judgment, you take a decision every day based on the local dynamics and on the national dynamics. So every day you make mistakes, you take a new decision, then you revert the decision. No, I'll not do this. I'll do that tomorrow. Then few doctors will come. Today I had a bunch of doctors. See, about 5 or 6 of them, they came. And they said, okay, look, sir, what to do? We have no business. And I think we should start admitting patients. No. That's your call, not my call. Again, see, Kanpur does not have any COVID testing facilities in the private sector. My application pending for last 3 months. Now suddenly it'll be cleared by ICMR in a day or 2. I didn't know when I applied that corona would be coming, but I had bought a machine, which will go for it. Only government sector is doing. So yesterday I met the Principal Secretary Health and I told him, look, if you want the non-corona patients not to die, you have to give facilities to private sector to test for COVID. You can't control it. It's just not possible. You can't strain the population. How will you do for the normal patients? And people will not die of corona. They will die of chronic diseases, which will be the worst thing for the country.
Thank you so much. I mean, those are the hard realities that we are simultaneously facing. There is a little bit of the uncertainty in the policy and regulatory environment. It changes from district to district, depending on who the administrator is. And frankly, I mean, it's also an evolving situation. Into this, let me kind of pivot back to Mr. Paresh Chaudhry. I mean, you had laid out this broad framework of both character and of responding to the situation with all things that you had prepared for. We've heard from the hospitals directly, people who are at the front lines. And then from a broader perspective, how are you seeing this response gelling in with the entire landscape before we kind of drill down to the specific, let's say, innovators and technology assets in the healthcare space?
Yeah. So, I mean, heard from very enthusiastic Dr. Atul and, from Dharmendra. Also, I think what Mr. Nagar also said, I launched the Wokhart hospitals in India and also the Fortis hospitals in India many years ago. And I think the reputation of the medical services, the healthcare system in India itself is suspect. Right? So people suspect that, okay, but you go to a doctor, then you get admitted, they have targets, etc., etc. I think this situation will change because they will find true heroes in many places. Everybody talks about business, which is fine. I was reading some article yesterday, Bobby, and very interesting article by a thought leader who said, are you saying that the minute COVID hits India, that people have stopped having heart attacks, stopped having brain tumors, and started having chronic diseases? I mean, 18, 19 million children die in India of diarrhea and malaria and, on malnutrition. We've just had a few thousand deaths. So what has really happened? Is it happened because people are scared or to go to a hospital? So one of my cousin's husband had a severe stroke. And and he was rushed because he had a severe stroke, so he rushed to the hospital. In Bombay, there are no beds, by the way. Okay, so there's no beds for non-COVID patients by and large, because everything is full. So not just COVID, but there are non-COVID patients, and there's a problem. So people are going, but I think the healthcare system and the administrators and the CEOs and the hospital managers will have to now sit back and decide and look at the reputation while running the hospitals and nursing homes going forward, so that they build credibility again. We found great heroes. I think we've done the talis and we've done all of that now. And I've seen personally many heroes across the country. And I think Dr. Atul Kapoor directs from the heart. His speech on what he said about what's happening in hospitals is a testimony to that. Just on other bit, since we are still on, I'm not too sure we are still on the first topic of socio-economic, but I think the next mantra for communication across sectors, across people, is going to be on sustainability and climate change. It has to be. We have taken the Mother Earth for granted. We've taken people for granted. We've taken stakeholders for granted. We've done all of that. We've drawn theories. We've done models and all of that. I think sustainability and climate change is going to be a massive roadmap that every single company will have to take whether into services or they're into brand. Lastly, I think this remote control working at home will work only, say, for IT sectors, but for manufacturing, for doctors like Dr. Atul Kapoor and for Shuchin, who's been in hospital for 17, 18 hours, my good friends in Bombay who do not go home, who stay there for 4, 5, 6 days in hospitals, very senior doctors and medical professionals, including nurses, they and manufacturing sectors, they cannot remotely work at home. We run power plants, we run electricity, we supply electricity to Bombay. We run the ports, right? We are the engines of economy in India. You cannot do this remotely at home. But there would be ways and means of saying, पहले तो इतना भागा करते थे बॉस, सुबह से रात तक भागो, ट्यूसडे को एक फ्लाइट लो, 4 घंटे की मीटिंग के लिए आप लंदन जाओ, 2 घंटे की मीटिंग के लिए सिंगापुर जाओ. All that will be now history. So we'll have to, there's ways of using technology. That's why I think somewhere we'll have to cut cost, but this mad rush will slow down. When I stand on my deck and I look at the sea and I look at the buildings in front of me, I can actually see those buildings because there's no smog anymore. And it's wonderful. I was talking to my chairman on the Apex board on various things that we do every day. I was saying, yaar, main har hafte Ahmedabad aata hu. Can we do this every 2 weeks? Because we don't need to do that. It's always good to have technology. So I think things will change. People's behavior will change. But mind you, this is a 2 or 3 quarter, Bobby, kind of phenomena. In 1918, when we had 50 million people dying because of the flu, that time there was no medical services, there's no technology. The GDP came back very quickly. Then there was a World War I, there was a World War II. We all survived that. Right, so it is just going to teach you a lesson that जो पहले करना था अभी कर लो. अगर ये नहीं होता, तो it's like the God's hand, and people are saying, and I'm very happy this has happened to all of us, because from the guy who's on the auto to the guy who's sitting the chairman at a large company and senior doctors and junior doctors, we realize the value of humanity, realize the value of humanizing brands. And caring about each other. I think that will what happen. It's become a very greedy world. So I'm very glad this has happened, and it'll all be great.
Right, Kamal. I want to kind of turn to my colleague Kamal. We are nearly at the halfway mark. Is there a comment from you? Is there a question that you want to direct to one of our earlier panelists before I bring in Anshu Gupta and the rest of the technology people into the conversation?
Thanks, Bobby. Yes. So. I was really amazed to see wonderful thoughts from all our speakers. But I would like to, take a macro level view on our economy. And I would like to ask one question from Dr. Bindra. So when he's talking about that, how businesses need to adapt, business need to re-innovate, businesses need to re-strategize, evaluate their risk factors and mitigate that. Dr. Bindra, how do you think it from the country point of view? Consider the government of India or any country, government of any country at present time, and if our Prime Minister is the CEO, and this is the country which is his company, how should he actually adapt to this problem? how he should reinvent this country, how he should, make the society adapt to the new problems, and also how we can mitigate the risk of maybe next pandemic, or the next similar kind of situation when you again have to shut down the economy or shut down your company.
Thank you, Mr. Kamal. Yeah, thank you, Mr. Kamal. I'll begin with first on the positive aspect of what the CEO, as you mentioned, of our country, Mr. Prime Minister Modi. So he took very quick 5 decisions. So quick decisions of immediate action on airport closures and complete lockdown when US and Europe was moving freely. That showed his decision-making ability. That's one. Second, inspiring community initiatives by the PM. This got the nation together by clapping and lightning. So lesson is to achieve big, you've got to collaborate with the community. The third is building innovations around trains, making them ICUs, low-cost ventilators. The lesson is the rapid low-cost innovation. That's 3. I'll take to the 4th point. Encouraged and inspired millions to contribute through PM CARES Fund, or got the religious organizations to come forward like ISKCON, feeding millions of people, Gurudwaras feeding millions of people, spiritual organizations participating and engaging the community here also, finding that possibility. Our PM, who acts like a CEO, is a great storyteller, and he actually creates a great, compelling, exciting story to communicate. And he likes to communicate with the end consumer so straight without keeping the middle stakeholders in between. And 5th good point I'll share, what he has done already is the reward and punishment model. Wherever the low COVID breakouts are there, the business is allowed in phases. Wherever there is a high COVID breakout, the lockdown continues and sealing continues. The lesson is the carrot and stick creates discipline. Sometimes you got to offer carrot and sometimes you got to show a stick. But quickly, what will happen? This COVID-19 will become part of our lives for a little longer time. Like somebody said, at least 3 or 4 quarters, you'll see some improvements coming back. So the safety norms, social distancing, regular sanitization, wearing the mask will now have to become part of the working culture in communities. But people working remotely from home and ERP tools will drive the major part of the work culture. Redundant tasks will get eliminated. Smaller teams will get formed, and team members taking extra initiatives will survive. The rest is going to struggle. But one area of improvement is the general administrative expenditures which have been happening while in the growth phase. There are a lot of inefficiencies which are in GNA, which is general administrative expenditures. So you've got to optimize as an organization, as a country. For example, the fuel prices are going low. Now, Prime Minister Modi's got to pass down that benefit to a normal consumer. The economy will grow with only one principle, which is called consumption. The Prime Minister as a CEO has to find out the way to increase the consumption. How will that happen? Now, that is one area where a lot of bottlenecks are coming in between. So, you were saying something.
Yeah. So, right, you actually highlighted very important point that the CEO of the company has to ensure that the economy is moving and getting operationalized. Just a small intervention I want from your side. The CEO has done his job. The CEO has taken the right decision, had shut down the economy, trying to reopen the economy, has kind of taken all the important actions as you described. Now, what is the role of the employees? And let's say consider employees are the 1.35 billion people of this country, and the businesses are those leaders who are at the second in command and third in command of the second in line of the companies. What is our collective responsibility now, and how we should respond to this the drive which the Prime Minister is leading of road to recovery?
Yeah, as far as the employees are concerned, now they've got to understand कि जिस वर्क फ्रॉम होम की इच्छा थी, अभी धीरे धीरे वो अच्छा नहीं लग रहा, वो इच्छा अब अच्छी नहीं लग रही है. When you're looking at employees, they've got to focus on few things. One is they have to follow the regular working hours when they're working from home. as a leader, they've got to keep their personal time and office time separate. Entrepreneur is already doing that. Like I think some doctor here mentioned, Dr. Shuchin Bajaj mentioned that an entrepreneur is somebody when he actually falls down the building, he actually has to create his own parachute and start flying, or he has to create his own plane and immediately has to take off even before landing. So, but for employees, they've got to be very conscious of planning their days and break and dress well while they're working from home. Don't wear the night suit, create the work schedule, don't slouch on the bed. You've got to create an office space environment, create boundaries between your pets and kids and office environment, stay connected at office, keep less distraction and focus on what matters the most. Here's the golden statement. Focus on what matters the most.
Right.
Doordarshan just took my interview as founder and CEO of BadaBusiness.com. I'm helping a lot of entrepreneurs. And in the interview, just 15 minutes before we started this event, I answered them one important area because employees are disturbed at home, saying कि इतना काम करना पड़ रहा है, इतना काम करना पड़ रहा है. पहले खाली 9 से 6 काम करते थे, अभी सुबह 9 से रात 12 बजे तक घर पे बैठ के काम करते हैं. So what to do is focus on what matters the most. Right. Your bosses don't like you doing too many things. They like what did you do effectively and efficiently that helped the organization contribute to the major goals. Thank you very much.
Thank you so much, Dr. Bindra. Thank you. Over to you, Bobby. Just let me summarize this remark because I asked on the point of view of the public as employee. So I believe I can take this statement forward that focus on what matter most. So for public also, they have to look into what matter most at this time when it comes to this crisis, how they can contribute collectively to mitigate the risk, how they can keep themselves safe, how they can make others, stay safe, how they can contribute to the, the communities which are deprived, which are not getting enough support. And I think that is what I can consider what Dr. Bindra says as focus what matters most. Over to you.
Yeah, thanks, Kamal. I mean, before I come to Sridhar, to Savitha, to Radha, and to Rajesh, I want to kind of take that, focus on what matters the most. And I want to kind of bring in Anshu Gupta here, founder of Goonj, Magsaysay Award winner. What matters the most? People. I mean, and yes, we can talk about the enterprise, we can talk about the community, we can talk about technologies that will enable us. But what matters the most? The people. Where are they, and what do we need to do to show that we are acting in the interests of those that matter the most?
Thank you all. So to be honest, Kamal and Vivek also, absolutely wrong narrative you guys are trying to build up. The country is not a company at all. Fine. I think let's not glamorize things like this, because this is what we have been. So many people are glamorizing work from home without even understanding that how many people can really do that. Companies are not, you can't call a country a company, because we have also seen in this particular disaster how the companies have behaved with their people. Fine. And let me be very upfront about it, because we are not here to do all these webinars to really do the tom-tom of our acts. It's very simple. I mean, the fact remains that when millions of these people got up in a minute, they didn't trust their companies. They didn't trust their employees. And they didn't trust their employers. They didn't trust their contractors. They didn't trust their neighbors. And we also didn't stop them. We couldn't stop them. So it's a question of humanity. It's a question of the way the business and people like us who were minting money were looking at life. It's very simple. I think it's extremely important for all of us to shun our arrogance now and accept that we have done a blunder because we never took care of people in our life in the last so many years. How come it happened? How come it happened that the person who was working with us for last 20 years, 10 years, didn't even trust me or trust us for 10 minutes? Are we still with that arrogance that we are running a very successful company? No, we are not. Most of the big companies have failed, absolutely failed. All this contractor system where you don't want to pay a lot of social security stuff and all that is miserably failed. It has actually proven, this country has proved that a large part of these so-called informal sector people like us have been exploiting them left, right, and center. And if you heard some of the earlier sessions, I always used to say that slums are not the extension of the cities. Slums are the extension of the villages, and this is absolutely proved this time. Because every single person went back to the villages. They came here in distress. They remained. They never had an appointment letter with them. Fine. when I migrated from Dehradun, I had an interview call from Indian Institute of Mass Communication way back in 1990. But when these millions of people migrated from the villages, they migrated because people like us got our customers in the cities. We never took care of the village. Farming in this country is still an unskilled profession. So someone who really invents 200 different kind of rice and rajma is unskilled. And people like me and you who write papers on them in the universities for our PhDs, which is of no national use at all. It only adds doctor with my name. It is never put to use in the public domain, is called skilled. We bring farmers from the villages to make them plumbers and electricians. I think we really have to relook at the society. Let's not talk all these big things. These millions of people have gone back in miseries. That's what I'm repeating. They came here in miseries. They stayed here in miseries. They went back in miseries. हम लोग यहाँ बाजू की मदर डेयरी में नहीं जाते हैं चल के, और वो बंदा 500-600 किलोमीटर उठ के चला अपनी फैमिली के साथ में. Do we understand what was that? So I'm saying it is a tamacha, it is a thappad on all the people like us who couldn't take care of our people. Very simple. मैं private healthcare को आज भी सवाल उठा रहा हूँ. I'm putting a question on all of them because what got respect was the government health system. Every single thing which was discarded in this country, the social development sector, the NGOs were grossly discarded by so many agencies. They did a wonderful job. Ordinary people, the middle class people and the upper class, whatever class people, they did a wonderful job. They took all the risk without a PPE, went out, served food. And the fact remains that millions of people who survived in the last few days on the roads are largely because of the NGOs and the common citizen of this country. They cooked meal and they served. Government health system, the PHCs,
right.
We never invested anything on them. They are the valuable. Air India, which we discarded, is the most valuable now. So I think most important when we talk about the people and places, I think it's extremely important that virus has done such a wonderful thing to us because we couldn't stop global warming, we couldn't clean Ganga, but the virus has done that. Similarly, virus needs to really change our thought process also. I mean, because we see distress, we are operational in 20 states now, and we see huge distress, and the larger distress is certainly the village India, which is already very hard pressed. Now village India has more people, less resources. Sure. And we all are worried about the migrants in the cities because we are worried about the workers.
Right.
And Fred, I'm just must...
yes, Mr. Chaudhry, yes. I would have come to you for a response.
You came for the second session and I was for the first one. And there's exactly two things that I said very, very vividly and very loudly was, this is the time to show character. And not just of companies, but of everybody. And you rightly said, I'm part of many NGOs. Individual people who can be sitting at home, but they have dared to go out, cook meals. They've gone to senior citizens' house whose kids are working abroad and who couldn't even come back to their old parents. They've got maids who can't come back home. So everyone, and there are government hospitals who've risen. The doctors in the government hospitals, the PHCs are the guys who are actually the real heroes, right? And also second thing which I said was, the one thing the virus has done, at least hopefully, consciously, is going to make us realize that we need to humanize the brand, and there's something called humanity. So ye ek dusre ke baare mein jo love hai na, hopefully that will survive, and that will be seen for some time. But India being India and the world being in the world it is, and greed is a center factor, I know how long this will last. But even if it lasts for a few quarters, I think we should bask in their glory.
Sure. This is where, thank you so much, both Mr. Chaudhry and Anshu. Thank you so much for, you're always a powerful jolt of reality for conversations every time we speak. And thank you for focusing our attention to what matters the most. There are people, there are millions, tens of millions of people right now in flux who didn't choose to trust the ecosystems that they were part of, and chose to revert back to what they knew most. And so therefore, that's something, as you said, a tamacha to our face, and we need to look at it. Let me turn to, while technology cannot be a fix for everything, can it allow for some things to be done better? And this is where I'll come back to both Anshu, to you, and to Mr. Chaudhry once again, and before I go back to the hospitals. But focusing on Sridhar, and Radha, on Savitha and Rajesh, what is it that technology can do to help what matters the most? a bunch of people who found themselves on the margins every which way, on the margins of their villages, on the margins of our cities, and are kind of in no man's land even today, and have the same kind of healthcare requirements that you and I have, minus all the privileges. They need access to the same kind of hospitals that Dr. Kapoor or Dr. Nagar or Dr. Bajaj run, or what failing that, they've reverted to the government hospitals. What is the opportunity? What is it that technology today offers? One, by way of the instrumentation. Second, by way of knowledge. Let me start with Sridhar, then I'll go to Savitha, and then Radha, and to Rajesh. Sridhar.
Yeah. So first of all, I think I should acknowledge the contribution made by the medical fraternity. For the last few weeks, what I've been seeing, the contribution made by the medical and paramedical staff is definitely overwhelming. I get tears when I speak to them, the kind of efforts they put in, the kind of sacrifices they make, really amazing. And at the same time, I think there are quite a bit of challenges in this country. Not only, you don't have to even first go to the rural part, even in the urban areas, I see there is a lot of misconceptions, there are a lot of challenges and pressures. On one side, as many of the doctors said here, it is not just uncertainty of what has to be done. There are financial pressure, there are staff motivation pressures. There are quite a lot of things which are there as to how do you treat a patient, when should I start treating a patient who's not COVID and all that. There is quite a lot of uncertainty which is there. And on the other side, I think patients also, the public has taken a few things to an extreme. For example, anything other than COVID, if only you have these three symptoms of fever, coughing, and sneezing, cold, and all that, that's the only thing which needs to be attended to. The other things can wait. In fact, I had a personal experience in my own family. I had my uncle who had 5 days of severe fever, and everybody started suspecting it to be COVID. The entire apartment complex started, saying that you need to be quarantined and all that. We did all that, and when the test result came negative COVID, it gave such a big sigh of relief and said, "Oh, thank God, it's just urinary infection." I said, "Come on, urinary infection is more dangerous. In fact, we think this one is actually, at least the COVID one, the many people are surviving. But people, even at a severe urinary infection, are willing to discard it and say, as long as it's not COVID, it's okay." So I could see the kind of crazy thing which actually has happened in the understanding. And that's one reason why people are not venturing out to the hospital or not able to reach out to customers. So we understood this. So as a technology company, we actually have some solutions. First, to handle the suspects and COVID patients, we have some remote monitoring devices, whether it's in terms of temperature, oxygen saturation, and all that. We have been able not only to provide to private hospitals in the city, but we also have adopted a few villages inside and see where the COVID centers are there. We have given it to suspects, and we actually have found some donors also who are able to give it. First, to take care of those patients where we will try and minimize the risk of the healthcare workers and doctors to see as much as possible, if they can actually do remote without getting closer to the patient. At least that can be a great contribution from our side. That is one. Now, when the situation improves and, when we say that, okay, there is no more threat, but still I feel that there will be a lot of suspicion in people's mind. They're not going to venture out into the hospitals and clinic so easily. And I've been talking to a few hospitals, like even in remote Lucknow, I was talking to one of the big hospitals which actually caters to a lot of villages around. We are seeing how we can use the technology to reach out, right? Not only people who have smartphones, but people who have button phones. How can we use the voice method? How can we use the IVRS facility? How can we educate them? And immediately people are saying that how will they be able to pay? So even if they don't pay, can we find people who can actually help them pay, so that their immediate needs are taken care? And even if you have to proactively reach out and say, if there is anything, please reach out. Don't wait till things become serious. So that, as Dr. Nagar and Dr. Atul and all were saying, it is not for people to take the other symptoms lightly and then wait for it to become a serious condition, and then it comes into a helpless situation. So I feel at this point of time, if technology can help not only handle the current patients who actually are critical and thereby save the risk of doctors and healthcare workers getting exposed, at the same time, when situation improves and when we get into the normal situation, how we can facilitate things happen in a smooth manner, so that all patients who really deserve, who really need to communicate with doctors, are given the right connection is very important. So if that tools are available, it really will maintain the healthcare system to a different level. That's what I
Sure.
feel.
Thanks. I mean, so there are tools available that allow you to allows the healthcare professions and the institutions to get better. Let's put it this way: acquire. Sorry, I've been on mute for a while. Sorry, I've been on mute. So thank you so much. We have tools today to acquire symptoms and signs from people, not from suspects. I don't like the word suspects. Everybody is a human being. Nobody is suspected. People, and these are words. I mean, we don't have social distancing. We have physical distancing, social solidarity, physical distancing. We have people with disease, not suspects. I mean, the words that we use, we need to be mindful of, because at the end of the day, it's our brothers and sisters that we're talking about. Yes, we have the tools, and I think it allows for bridging of the gap. It allows for the hospitals to double or treble their capabilities with the technologies that are available. We look to that as we go future. But there's also the need for knowledge. This is an ever evolving landscape. What we knew, say, 50 days ago is different from the new paper that's coming up in the med archive and then published. So where does the knowledge management happen for the people? There's the signs and symptoms that are being picked up by technology. Then there is the knowledge and the wisdom that needs to be now translated and transferred to individuals. How do you do that, Savitha Kuttan, with a rapidly evolving scenario as COVID right now?
Right. Hi, Dr. Bobby. Glad to be part of this and hosting this with the IHW Council. So before I get to the specifics of what you asked, I just wanted to make one statement regarding the theme of this program, which says many fronts and one fight. So this is one which is, though we are defining it as a war, in a regular war, it is only the frontline soldiers who are actually doing the war. And the rest of us are quite helpless. We are sitting at home and, waiting and watching. Here we have an opportunity for every single individual to contribute, be it, all of us we're talking here, be it a general public, to make sure that they remain safe and they do not really become a cause for transmission, be it an entrepreneur who can actually think and reinvent himself to see what is an opportunity in this scenario, how can he help the country, how can he help the people, be it professionals, be it organizations who are looking at newer dimensions of work. TCS came up with a fresh perspective. How does it help cutting the cost and cutting the real estate cost, and thus improving productivity overall? So this is where every single individual has a contribution to make, to really fight for it. So that's why I really like this kind of a theme, that though it is a war, though all of us are fighting individually at our own capabilities and capacity, it is one single fight. It has been created by one single enemy, and we are all fighting to defeat it, and newer territories emerge, newer paradigms emerge. So with that, I will move on to the question on technology. So what is it that we were seeing on technology front is that healthcare generally as an industry has been one of the laggard when it comes to adoption of technology. And primarily it was also because the need of adoption needs always, you need to have it at the macroeconomics level. If you see, there has to be a demand supply balance, right? The Flipkarts and Amazons of the world are coming up and growing so well because there are enough suppliers and there are enough enough demand. Whereas in the healthcare, if you look at, because our country has been facing an acute shortage of, be it beds, be it doctors, be it all the healthcare ecosystem, and because of the inherent reluctance to move towards technology, it has been rather slow. Irrespective of immense funding which the healthcare startups have got, tech startups have got in the last few years, it has still been rather slow when you compare it with any other industries which has seen that kind of a technology shift. So in this current scenario of COVID, what I've been hearing and what we've been reading is that it is just like one of our eminent panelists said, that the entire healthcare ecosystem is actually kind of just pushed out of a plane, and they have no choice but to go towards technology. So we are seeing a significant kind of improvement and shift towards adoption of technology. The macro numbers do suggest there's a 1.5 times increase in smartphone adoption and the internet consumption, and newer number of consumers who are coming into the technology, challenging the age-old assumptions of demographics and connecting it with tech adoption. So we are seeing fundamental shift, and glad to see the shift happening with doctors who are
I believe we may have a little bit of a problem with Savitha's line. Dr. Radha, I mean, just to pick up on where she was kind of talking, and where does HealthCube and your work at kind of help us address this situation right now?
Thanks, Dr. Bobby, for a chance to participate in this very lively and interesting discussion. One of the themes that I think hasn't emerged from in the discussion so far is the problem that we that we're all currently facing, and that is the quantum of testing that is happening in this country. And why is that relevant to anyone? It's relevant because as we emerge from this lockdown, there are genuine fears in people's minds about going back to work, about the safety of communities, about the safety of rural areas, because migrant workers are going home. And we don't have any ways of really testing at the scale that is required for a country of our size. And it's not that anyone could have anticipated how much capacity we need in this country, but the kind of test that is required, an RT-PCR test, it's actually a very sophisticated laboratory test. And it's not likely that every diagnostic lab will have the equipment or the people to do this test. So we're really right now facing a very major problem with what kind of technology is available for testing purposes. And I think that we have to simplify the test and we have to make it more easily available. And the scientists in this country need to make that one of their important goals. That is how they can contribute. Now, I'm a scientist myself. I know it's not that easy. This is an RNA virus. Existing technologies like PCR, if it had been a DNA virus, it may have been easier, but you have to reverse transcribe the RNA into DNA and then do the amplification. These are not easy things. So I fully agree that the test cannot be perhaps simplified to the point where every diagnostic lab can run it or it can become totally point of care. However, in the absence of such simplification of technology, then we still do need to pay attention to this testing problem. For example, when the lockdown lifts and people want to go back to work, how are you going to keep workplaces and communities safe without testing? So the fundamental problem that I think we need to address now is one of this testing gap. So what we are looking at is we're admitting that there's no way we can do RT-PCR the way that perhaps Germany is doing it. 350,000 tests a day, 1 million out of 80 million people have been tested. I mean, there's no way we can reach those numbers. We don't need those numbers.
There is. But I want to contest that. I want to contest that. There is a way, and I think that is something that we are fundamentally missing. Sure. So
that's what I'm coming to.
Sure.
I'm coming to that. So how can we actually get to effective testing or sufficient testing? And we have to take some sort of a rational but systematic approach to saying who needs the test. And it can't be so. Right now there are certain criteria which allow people to be tested, but the criteria need to be widened a bit. But we have to do more. For example, if you look at the risk factors, and if you look at medical history, and if you look at symptoms, and you look at exposure history, and keep in mind that in this country, many people don't know that they're diabetic. Many people don't know that they're hypertensive. Many people don't know they have cardiac problems. So bring in effective primary care screening into a risk assessment process and identify people who need to be tested. Now you've got a rational way, a systematic way of saying, look, this is the number, not 1.2 billion people, but here is the number of people who really need to be tested, and let's prioritize testing for them. Age is a huge factor, right? So there is this is the kind of screening process that we are advocating. HealthCube has devices in rural areas, in tier 2, tier 3 towns where nobody's heard of a diagnostic lab. You can't get to a diagnostic lab easily, let alone ship a sample, a nasopharyngeal swab, hundreds of kilometers away to an urban center. So what we are saying, use the existing understanding of this disease to prioritize testing and care for those who need it most. So
sorry to cut, but there is no dispute in what you're saying. In fact, right from the beginning, WHO has been very, very clear. Unless we have a large-scale test approach, it is going to be very, very difficult for us to address the need on the ground. And at the end of the day, it is not people like you and me who are sitting in fairly safe environments who need that test. It's people who have got the maximum amount of exposures that need the test. And we have failed. We have failed to get them. And this is where I want to kind of bring in Mr. Rajesh Aggarwal. I mean, whose company, Insecticides India, it works with people who are actually at the grassroots level. That's the community where we have, I mean, his company manages to get supplies into place. Is there a way, sir, that we can begin to figure how we work with companies like you or enterprises like you to address the needs at the point where it is? If you can get a can of stuff there to them, what does it take? And then I just want to add one more thing and then kind of get to you. To Dr. Radha's point where I was disputing that we can do it, not disputing, actually amplifying it. Our colleges, wherever there is an MSc course running or where there is a BSc zoology course running, in just like the Y2K problem that we tried to solve 25 years ago and had every Tom, Dick, Harry college produce IT engineers, is it about time that we kind of realize that we've missed a large opportunity on training a large number of people? What did we do? Dr. Rajesh.
Thanks, Dr. Bobby. So as you mentioned, like my business is a little different because everybody here is taking care of the human health and we are the people who take care of the plant health or the crop health actually. So we focus around the basic necessity, which is food, and we serve the smallest entrepreneur in the society, the farmer, who is taking so much risk for cultivating food for us, and it consumes more than 60% of the population, which is contributing, say, 70% to the GDP. But in this lockdown, we have realized that food is the basic necessity which is required, and that is one of the reasons that we were put in the essential product list, actually. Yes, definitely, the education system needs an improvement because over years, I also believe that there is not much improvement in our systems, and whatever the education is being given in the universities and colleges, the still old, and it is not with the focus of training the people for the profession or for the crisis. Instead of doing that basic knowledge, we are imparting the knowledge, but what is more bookish type of knowledge, and that is one big reason actually when it comes to doing the general things or any specialized things or facing the pandemic or facing any challenge, our people sometimes fail. So that is something I feel it's a struggle actually. But in this point of struggle, my view is that we have to take care of both the customers, the internal customer and the external customer, because the internal customer or the team are the people who are responsible for bringing you where you are established, and they have played a very vital role. I heard people saying about positive about the employees and some people doubting, like, yes, we have seen people moving down back to the villages. But I believe that there are both type of people actually. Some because most of the people are, I would say, they don't belong to the organized sector. So in the unorganized sectors, yes, people have taken a hit and they let they believe. But we have seen a lot of industries like closing, shutting down. So it may have been the impact of those industries. But I feel we are lucky because the day the announcement was made and we had to call back our teams. So we were very successful in bringing down the teams, though there were challenges because there were family pressures and the people who were living there, not with their family, there were pressures from the colonies and there were pressures from the panchayat because some of the villages, they stopped the people from moving out and moving in. So there was a degree of fear also, which I observed. But yes, the different businesses can work together, and if we can work in the farm, in the villages, and we can take the things to the villages, yes, the things can be controlled better.
Mr. Aggarwal, thank you so much. I mean, there's something that you said that's very, very powerful there that I want to kind of repeat for our audience. And that's something that I want to then come back to Savitha with that question. You said, among the many other things, that there is a dichotomy between the kinds of teaching that we're doing and the kinds of knowledge that we require. There is a bookish focus with a complete absence of a practical application and reality where we need to adapt very quickly and say, this is what we have learned, this is what we need to apply. And in many ways, I mean, that's a big gap that's also being exposed to us. Savitha, you first, then Anshu, and then I'll come back to the others in terms of just us exploring that a little bit in terms of what Mr. Aggarwal has really kind of put a finger on. Is this a moment that not only kind of helps us look at what matters most, who matters most, the healthcare system and the health of the country, but also as to how we are training ourselves to address crisis? Savitha Kuttan.
Yes, absolutely, Dr. Bobby. So, as our earlier panelist was talking, that in any field, if you look at in our country, the training is primarily academic, primarily bookish to get the degree in hand. So we are really not training our professionals for being, job ready, right? For being skill ready. So I think that's the thing that is definitely important, even in the healthcare system, that it's important for our medical professionals to, be prepared that if it comes to a pandemic situation like this, what is it that they should be doing? And it is also important for the state and the authorities to immediately look at a way of ramping up capacity at such a scenario, because you cannot do capacity building overnight. So they should have means and methods to identify if they need suddenly to increase capacity in a state because they have to now do more number of screenings, more number of diagnoses, then how are they going to go about it? So that is where some of the universities in our country, like the Maharashtra University of Health Science, Rajiv Gandhi University of Health Science, etc., are collaborating with Omnicuris to be able to build capacity for COVID treatment through the PG students and the final year med students. So what we're doing with them is, with the help of technology, we are getting them ready to handle a pandemic situation like this and all aspects of dealing with the situation like this, because there is not just the medical aspect of it. There is a lot more. There is counseling, there is, protection equipments, there is how do you really talk to a patient about it. So there is much more, that really needs to be trained and need to be taught them, and we have to keep them ready, because it just in case, God forbid, we reach a stage where we suddenly are looking at, increasing our capacity of healthcare professionals, we need to be ready. So, touching back to your earlier question, what I was telling about technology is that the government has come forward with technology with the recent this Arogya Setu app, which is helping in terms of surveillance, in terms of and the adoption is quite high. So that is also a very, very good point to see how technology has adopted in a need like this, which can be done for other diseases as well. You could put a surveillance app for something like tuberculosis, which we are struggling for such a long time. So yes, the technology has definitely come forward, and both for skilling as well as for various other aspects in the healthcare ecosystem.
Right. Thanks. Before I turn to Kamal to ask his set of questions, I know that he has a couple of questions for both Mr. Aggarwal and for Anshu. Let me kind of turn what Savitha Kuttan has said to the three of you, to Dr. Bajaj, to Dr. Kapoor, and to Dr. Radha Rangarajan. She's saying that we can get people to problem solve in real time. We can upskill them with new information or get them to be problem solvers in a crisis moment. And she was particularly mentioning about getting postgrad students up and running. Some of us have also said that finally medical students can be there. In hospital situations like yours, particularly to Dr. Kapoor and to Dr. Bajaj, would you be welcoming such let's put it, say, rapid, ready people who are coming in to bolster your capacities? What would be your responses? Dr. Bajaj first.
Thank you very much for this generous offer. See, make no mistake, we do have to understand that we are fighting a 21st century war with 20th century weapons. We do not have enough instruments or solutions to fight this, and actually nobody really understands what is going on. See, there are as Anshu said, the entire question is about what exactly is the right trade-off between quality of life and life itself. How much are you willing to trade off? How many people are you willing to let go to maybe benefit billions of people, or maybe there is no benefit at all? Nobody knows exactly what we are fighting against. These are two big things that nobody understands. neither does anyone understand the virus, nor does anyone understand the economy. The virus started out with it has an R naught of 2, 3, 6, 1.4. Sometimes the ventilators are very necessary, so build millions of them. Now it's like ventilators are harmful, so don't use them. HCQS was the magic pill. Now HCQS is killing more people. Smokers were supposed to die very quickly. Every smoker will die now, and now suddenly it's like only the smokers will live and nobody else will. So it's a complicated situation, and I believe the more hands on deck there are, the better the chances we have of fighting it. So this is a very generous offer. We would love to take it up. Very happy to join hands with anybody who's willing to help or willing to join the fight.
Right, Dr. Kapoor.
Thank you.
I agree with Savitha on this, and I agree with Dr. Bajaj also.
So we've lost you.
Yeah. Can you hear me?
Yes.
So basically, see, nobody has, a large knowledge on the virus. Everything is just 2 months or 3 months old.
Sure.
So everybody's working on it. You see, there's a mess all over the world. I mean, we can't say that we are best and they are bad. Whatever it is, people are still unsure of what is going to happen, the treatment, and going forward, the type of tests. Today RT-PCR test is okay. It's cumbersome. It has to be in big labs. But I'm very sure that just like HIV and HBsAg cards have come up, in 2-3 months' time, 4 months, 6 months, we have rapid cards which you can do easily, and testing shall be easy. RT-PCR is, tough job. But then again, it's something like something did not happen earlier. It never happened. So who knew what is the virus and what is going to happen? Yes, one thing I agree. See, when Anshu spoke, that yes, we have learned to, about people, about humanity, what they are, we should care for them more. See, everybody is not a bad employer, Anshu. But at the same time, I'm trying to say that yes, human value, being with family and being with your staff and people is what has taught us, cleaner environment. But going forward, see, technology will play a big role in the post-COVID era.
Sure. Right. Again, so which is where I turn to kind of both Dr. Radha and Sridhar. I mean, your quick things before I turn it to Kamal.
So basically, technology will play a big role. We'll come up with lots of devices, lots of material. But I'm telling you, as a doctor, I'm telling you, that we are always treating patients, spend our time 13-14 hours a day, and we don't think of technology. At that point of time, it is for the technocrats, the people running these companies who should make these devices and come to us for use. So that is where the parallel industry will come up with devices, equipment, machines, which will help us to do this thing forward. A lot of people are doing it. As they are doing, a lot of things are doing it. Dr. Bajaj said that, what he tried for the last 7 years, I'm trying for the last 10 years. This, consultation on very live consultation by after login and paying money. But suddenly 30 consultants have picked it up because there was a need. So earlier I was telling them, no, boss, this can't happen. It's not easy. Patients want to see me. They want to feel me. They want to see my smile, and all those things are happening. But then things have changed, and people will change. Life will change. What is going to change after 6 months, we don't know. I wish that we all, do well ultimately, and healthcare will play a big role, if not today and tomorrow also, and maybe the first industry to pick up after this Holocaust.
Right. Dr. Radha, Dr. Sridhar, quickly, please.
Dr. Bobby, I think that the times are such that we have no choice but to learn through technology, to adapt through technology. New knowledge is being reported every day. And, there's a lot that's not known. But whatever we know right now is because the Chinese scientists and the Chinese physicians chose to write and publish their work. Today, there's a phenomenal increase in how much is being written in the medical space about COVID. And while the studies are small, when there are no other options, one has to adopt new knowledge. And I think technology is the only way. But I think there's also a bigger opportunity for the Indian medical fraternity, because the only way that the world will learn is if we share our experiences and if we do research and report our work. And that needs to happen as well, because if you've learned something from your medical practice, then others need to know about it as well, because everyone is really clutching at straws. So I see here an opportunity for the Indian science and the medical fraternity to undertake very high quality research and publish it, because That's the only way. It's not as if it's not just to it's not for a CV. It's really because there is a pressing humanitarian need, and it can be done. But today I see a much bigger, I see a lot of work being done and published by the Chinese scientists and physicians, and I hope that India will follow as well.
From Helyxon, I mean, how is it that you're seeing the way forward?
So there is definitely a lot of opportunity for physicians to basically look at using the devices and the solutions that are available as to how they can actually give better treatment options, given the kind of uncertainties we already have now. Because to make both of them aware and in quick succession, it's not possible overnight for it to happen. So if we can actually come as a bridge in between and create a lot of awareness and then say how we can actually make the physicians make use of it for them to reach their patients, it will be of great use. I think earlier what used to happen is it used to be a pressure for physicians also saying that, okay, it is available, why don't you use it? Now it has become a necessity. And when they experience it by themselves, it will get consolidated. People will see, okay, there are flaws in it, there are challenges in it, but still if we can actually know how to live with it, it is easy for us to manage patients better. And there will be scenarios where patients have to be definitely seen. We are not going to eliminate that at all at any point of time. Wherever there is a possibility of the communication that can happen with minimal intervention and with the technology can actually play a role, why not? That's where I think we are able to provide those devices that on one side, and we also have the telemedicine solution which is there, which actually is more authentic, and there are a lot of guidelines also which are coming up. These things, I think, like how every sector, if you see whether it is telecommunication and all that, when many forces joined together, it actually saw a different transformation. Similarly, I think there are many forces which are joining together here. From the patient side, there is a need now. From the doctor side, there is a need now. The technology companies have come up with a lot of solutions. I think all these forces put together, and platforms also, video platforms and all are available now more in abundance.
Sure.
So all forces come together to begin a transformation. And I think the transformation will only evolve further and consolidate to make it much, much more authentic and reliable for physicians to get benefited out of it.
Right. Thank you. Thank you so much. I mean, at the center of it all, I mean, while we have technologies, we need to kind of go back to what matters most. It is people. We have 1.37 billion people. Give take, I mean, the accuracy of the numbers. How do we kind of make sure that it happens? Kamal, I mean, you had questions both for Anshu and for Mr. Aggarwal. You're on mute.
Thank you so much, Bobby. So, it was a good, jolt from Anshu when he said that we are trying to build a wrong narrative when we say a country as a company. So let me go towards more humanitarian issue. Mr. Rajesh Aggarwal and Anshu, Mr. Aggarwal you have always been working with the farmers. You have been ensuring that farmers get best of the technology, best of the product, so that they, are able to produce better and earn better. And for a country like ours, which is largely a agricultural society still, and gets a maximum support in the economy from that, it is an important aspect. One of the worry always I have seen has been that the farmers are not ready to remain farmers. Means the sons of farmers are not happy to continue the agricultural practices. And Anshu also mentioned very rightly that the plumbers and the electricians and the auto walas which we see in our cities, or those who are living in slums, they are extension of villages, and primarily many of them are farmers who have left farming or don't want to continue farming, and they have come to the cities. Post this humanitarian crisis, when you are seeing that cities are moving to villages, the cities are no longer an attraction for these millions of migrants. How do you see, is agriculture going to be some kind of fulfilling, glamorous profession? Will the government, will the society kind of support and recognize agriculture as some noble profession, or it is going to be business as usual in the future? Mr. Aggarwal. Is he there?
So the food habits also are changing, and as per the food habits, eating habits, the country is producing. Like the production of pulses was very less. In the past, the consumption of fruits, vegetable was very less. But as the recommendation is coming, the production is going up actually. So our farmer is changing with time, and the problem here again is the enterprising and innovating. So there are farmers who wish to continue with the tradition because it is believed that a person, if don't get a job somewhere and if he's not land, then he is doing agriculture. But now, yes, the modern children are coming into agriculture at a slow rate. But yes, if it becomes economic activity and the farmer starts running, definitely earning, then definitely more and more people will enter into farming, or I would say a professional farming, because already the population in farming is huge. 60% contributing 17-80% to the GDP is already very less. But yes, a change is required, and that change should come.
Thank you, sir. Anshu, क्या किसानों में क्या गांव में ज्यादा किसान होंगे, और अगर ज्यादा किसान होंगे तो कंपनीज लाइक IIL, राजेश अग्रवाल जी की जैसी कंपनियां क्या योगदान दे सकती हैं कि जो किसानों को कंट्रीब्यूशन तो है बट रिकॉग्निशन नहीं है, ना तो गांव में है, ना शहर में है, ना सरकार में है, तो उन किसानों को ज्यादा इज्जत, ज्यादा रिकॉग्निशन क्या मिल सकता है अगर ये सारी की सारी पॉपुलेशन जो आज सड़कों में 400, 500, 800 किलोमीटर चल करके अपने गांव में वापस जा रही है, तो क्या वहां पर इनफ ecosystem है to support them? And if there is an ecosystem, how it is going to turn out, and what companies like Mr. Aggarwal's can contribute to?
Acha, so Kamal, ek to kudos to you that you know me and still you call me for all these jolts and all. And Dr. Kapoor, we know that there are large number of people who are good employers, fine. But I think it's extremely important for all of us to really come next to the reality as early as possible. Because I think to me personally, this is a personal thing, with this panel, that in the last 2 decades, Goonj has handled a lot of disasters. My universities have been the villages. And I personally have spent a huge amount of time in the disaster. I spent about a month or 1.5 months in every disaster. But this has been one of the biggest personal sadness. बिकॉज मैं अभी उस चीज को कॉम्प्रिहेंड ही नहीं कर पा रहा, मैं उसको एक्सेप्ट नहीं कर पा रहा कि ये हुआ क्या, कैसे कोई उठ के चला गया. तो देखिए, मेरा ये मानना है कि दिस इज आल्सो अ करेक्ट टाइम, एंड आई वुड से दैट राजेश विल एग्री, एंड व्हाट राजेश इज आल्सो सेइंग, दिस इज एग्जैक्टली द करेक्ट टाइम टू रियली understand and value the ecosystem, which is 70% of our country. 70% of our country has been producing for 30% of the country so far. Fine. वो जो मैं बार बार कह रहा हूँ कि मेरे घर में तो 3 महीने का राशन भरा हुआ है चावल, और वो बंदा 100 ग्राम चावल के लिए लाइन में लगा हुआ, क्योंकि हम लोगों का the biggest problem in this country is that our benchmarking is very low. Right? We say that we give subsidy to the farmer, and I differ. I say we don't give subsidy to the farmer. Actually, farmers give us subsidy, because farming is one of the only large profession where there is no law of minimum wages. And the day me and Rajesh can calculate, all of us can calculate, if we start paying minimum wages to the farmers, we will not be able to really eat rice. So who is subsidizing? We are not subsidizing. Farmer has been subsidizing to us, and by giving 5 kg rice to them in relief, we call them beneficiaries. जबकि जिंदगी भर हम beneficiary रहते हैं इसके. तो ये definitions बदलनी है. दूसरा क्या है कि the entire lobby of profit making people, they have been working on cash crop, right? मुझे बताइए, ऐसे कितने farmers हैं who have been doing cash crop and are cash rich? How many farmers are there? Large number of farmers who have committed suicide in this country were actually working on cash crops only. And lot of these things are not bothering us, तभी क्योंकि हमने उसको एक normal अपने system में डाल लिया है, and the benchmarking is very low. So hunger death is not an issue. 10,000 plus farmers committing suicide every year is not even a news. अभी हमारा कोविड में 1000 लोग देश में गए हैं, तो वो बहुत बड़ी न्यूज है इस समय, फाइन, इज वन ऑफ द बिगेस्ट न्यूज. बट 12,000 फार्मर्स, वो जो ऑफिशियल डेटा कह रहा है, एवरी ईयर फॉर डेकेड्स हैव बीन कमिटिंग सुसाइड एवरी ईयर. वी आर नॉट इवन थिंकिंग अबाउट देम, वी आर नॉट इवन टॉकिंग अबाउट देम. तो मैं ये कह रहा हूं कि इकोसिस्टम है, गांव में इकोसिस्टम है, हम लोगों ने उसको इग्नोर करके रखा हुआ है. हम लोगों को कुछ अपने सामान बेचने हैं, खाद बेचने हैं, पेस्टिसाइड बेचने हैं, उनको हमें यहाँ सस्ती लेबर चाहिए, तो इसलिए हम उनको बुला रहे हैं, खत्म. The fact remains, we all know that even today, in 4,000, 5,000 rupees, a family or a farmer can survive in the village somehow. But in 10, 15,000 rupees, what kind of life do we give to that person in the city? So ecosystem hai, is just that many of us will have to really work more on innovation there. जब आप टेक्नोलॉजी की बात कर रहे हैं, ये पूरे इतने बड़े क्राइसिस में विलेज में कोई भी टेक्नोलॉजी बड़े लेवल पे क्यों नहीं काम आई? क्योंकि हम लोगों ने उस पर काम नहीं करा. We were too busy in making Zomatos. क्योंकि हमको यहाँ पे प्रोडक्ट चाहिए, तो हम लोग अपने घरों के अंदर बिल्कुल बैठ के सेफ हैं, जबकि बाहर ठेले वाला आ रहा है. बट उसके बाद भी अपन को जोमेटो से सब कुछ मिल सकता है, स्विगी से मिल सकता है. उस फार्मर को तो वो 100 ग्राम खाना नहीं मिल रहा. तो टेक्नोलॉजी क्या क्या हुआ? मैं यही तो बहुत बार कहता हूँ ना. आई थिंक इन अवर कॉन्फ्रेंस आल्सो अर्लियर आई हैव सेड दैट बाय क्रिएटिंग roti.com यू डोंट प्रोवाइड रोटी. या ऐप बनाना मतलब टेक्नोलॉजी नहीं है. तो हाउ डू वी, ये जो सब होता है वो इसलिए होता है कि हम अपने लेंसेज से देखते हैं. We see the problem through our lenses, we find the solution through our lenses. If this is the time, which is where the so migration जैसे दो तरह का है ना. जैसे मैं माइग्रेटेड हूँ, तो I migrated by choice, but large part of the country migrates by, they migrate by compulsion. तो जो कंपल्शन में माइग्रेटेड लोग थे, उसमें से बहुत सारे लोग कंपल्शन में वापस चले गए. यदि हम, ये जो लोग यहाँ बैठे हैं और सुन रहे हैं, यदि थोड़ा सा मेहनत करें दिल खोल के अपना, तो मैं गारंटी दे रहा हूं कि इनमें से बहुत सारे लोग वहीं के वहीं रह सकते हैं. Cities will improve, village will improve, life will improve. But the nation has to really, bring a lot of smartness, original thinking. We in the villages, वहां की wisdom को वैल्यू करना पड़ेगा, वहां की लाइफ को वैल्यू करना पड़ेगा. और जो ये जुगाड़ वर्ड है ना हमारे देश में, जो मतलब हम जैसे कुछ लोग 2 तार जोड़ दे तो इनोवेशन है, और गांव का किसान 100 किस्म के चावल निकाले तो जुगाड़ है. वो एक इंजन से ट्रैक्टर भी चला दे, खेत भी सींच दे, तो वो जुगाड़ है. ये सारा हमारा प्रॉब्लम है. तो जिस दिन ये चेंज होगा, द डे वी चेंज अवर थॉट प्रोसेस एंड वी स्टार्ट वैल्यूइंग पीपल, वी इंक्रीज द बेंचमार्किंग, आई कैन गारंटी यू थिंग्स विल चेंज.
Anshu, just one brief remark. How Goonj is going to help that these migrants, when they are going back to the villages, they get some kind of more support in terms of that there is a ecosystem, there is a life possible there, they can live well. Maybe they may not get the charm of cities, but they will get all those possible, which is important for human being to live. How Goonj is going to help on that, and then I'll ask Mr. Rajesh that how his IIL and IIL Foundation is going to take this forward.
चलिए, देखिए, पहली बात तो ये है कि सिटीज में ऐसा चार्म होता तो ये लोग ऐसे जाते नहीं. तो ऐसा ये यमुना पुष्टा में जिंदगी, यमुना के किनारे किसी स्लम में रहना है तो चार्म क्या है? हमें लगता है चार्म है, हमारे लिए चार्म है अभी भी, बट उन लोगों के लिए ऐसा कोई चार्म हम बचा नहीं है. कुतुब मीनार एक ही बार देखा, उसके बाद देखा, कहानी खत्म. ओके, तो वो इसलिए चले गए. What we are trying to do right from the beginning, even if you see the cover picture of our campaign, that is people walking. So we certainly thought that people will go back, but we thought कि वो joblessness वगैरह की वजह से जाएंगे. Suddenly no one actually anticipated, predicted all this what happened. The way people left. So right from the beginning, and thanks to the 2 decades of this work of laying pipeline in the villages or creating that grid of relationships, voluntary organizations, units of Indian Army, जो हमारा पूरा नेटवर्क है, प्लस क्योंकि हम मटेरियल में ही डील करते हैं, अदरवाइज ऑल्सो नॉन डिजास्टर ऑल्सो, तो मटेरियल की लॉजिस्टिक्स एंड ऑल दैट. तो उसका एक ये फायदा मिला है कि इन द लास्ट जस्ट फ्यू वीक्स, 3-4 weeks, we have been able to activate our entire grid in about 20 states with about 117 partner organizations as of now. और हमारा जो सारा काम है वो ये है कि हम फार्मिंग को कैसे थोड़ा सा चेंज करें. नंबर 1, पहला मोड सर्वाइवल का है, और उसमें एक जो बहुत इंपॉर्टेंट एस्पेक्ट विच इज देयर इज दैट इंस्टेड ऑफ जस्ट डूइंग एवरीथिंग लाइक दाल एंड चावल एंड ऑल, we're also putting a lot of stress on buying locally. So if a village has, or a farmer has 500 kgs of kaddu or lauki, that is a much bigger resource in that community than a dal coming from a city. So we are there for long term, and we also run a program called Vapsi, which is looking at the local employment and making sure that people do the local employment. मतलब हर गांव में एक पंचर की दुकान खुल जाए तो हो गए लोग employed.
So, thank you. So that means you are working on ground, trying to create the support system. Quickly from Mr. Aggarwal, because I think it's 6 o'clock and Bobby would like to wrap it up with our other health experts also, because that is also one area which does not get recognition on everyday life. Doctors are kind of criticized left, right, center. Every death in a hospital is a medical negligence. If it is in private hospital, for sure it is a medical negligence. So they will also come up with that, how we are going to change our mindset in future. Mr. Aggarwal, quickly, how your foundation and company is going to help these farmers live better, earn more?
देखिए, we have a very simple concept: innovate and take it to the farmer. आज बहुत सारी टेक्नोलॉजी है फार्मास्यूटिकल के अंदर, जो टेक्नोलॉजी जनरिक हो रही है, those products are coming very very fast. But if we look at agrochemicals, they are little slow because of the process. The government should encourage Make in India. There is a theme on which the country is working, but somehow the bureaucracy is not able to push it forward. So what is happening? We are getting delayed registrations. We have got the technology, we have got the people, we have got the engineers, doctors, everything is there. But still the technology is not reaching despite of the will of the company, because it's all the registration game. तो इन टेक्नोलॉजीज को मैं जितनी जल्दी फार्मर के पास ले जा सकता हूँ, बिकॉज व्हाट इज दी आज एम क्या है? आज एम है कि केमिकल का डोजिंग कैसे इस अर्थ पर कम कर सकते हैं, कैसे कम हो सकता है. वो तभी हो सकता है जब नए जनरेशन के प्रोडक्ट्स मार्केट के अंदर आएंगे और वो किसान तक जाएंगे और उस बजट पे जाएंगे जो अफोर्ड कर सकता है. क्योंकि जब टेक्नोलॉजी इनोवेटर लेके आता है तो इट इज एट अ प्राइस कि मेरी जेब में पैसा 10 रुपया है, मुझे दवाई चाहिए वो 100 रुपए की है, तो मैं कैसे लाऊंगा? नहीं ला सकता. अगर मुझे 10 रुपए में चाहिए तो जब वो मेक इन इंडिया होगा, जब कंपटीशन आ जाएगा, इंडिया में प्रोडक्ट बनने लगेगा, तभी वो एक आम आदमी को न्यू जनरेशन की दवा उपलब्ध होगी. एंड वी ट्राई टू वर्क अराउंड दैट. तो वो किसान के पास लाके और नई नई चीजों को लॉन्च करके बाय कोलैबोरेशन, वी आर आल्सो वर्किंग फॉर एनसी न्यू केमिस्ट्री डिस्कवरी आल्सो विद द जापानीज कोलैबोरेशन. तो हर टाइप का काम करने की कोशिश कर रहे हैं, जो रिवर्स इंजीनियरिंग करके जो टेक्नोलॉजीज हैं जो पेटेंट होती जा रही है उनको लाने की कोशिश कर रहे हैं और नई टेक्नोलॉजी को भी लाने की कोशिश कर रहे हैं एट अ प्राइस विच इज अफोर्डेबल टू द फार्मर. दो बात जरूर और कहना चाहूंगा यहाँ पर कि हमारे एफर्ट्स तो ऑन है, लेकिन क्योंकि मास्टर्स इसको सुन भी रहे होंगे, देख भी रहे होंगे फार्मर डेथ्स के बारे में. ये जो डेथ्स हो रहे हैं फार्मर के, दे आर मेजरली इनटू द ड्राई एरियाज. नर्मदा अगर हम क्रॉस कर लेते हैं जो एमपी में है, उसके बाद में पानी की बहुत बड़ी मुश्किल हो जाती है. बहुत सारे ड्राई एरियाज, नॉर्दर्न प्लेन को छोड़ के पानी की हमारे कंट्री में बहुत बड़ी समस्या है. एग्रीकल्चर के लिए सबसे बेसिक जरूरत पानी है. आप देखेंगे जो फार्मर डेथ्स होती है, कभी नॉर्थ ईस्ट में नहीं सुनेंगे, कभी नॉर्थ में नहीं सुनेंगे. दे आर वेरी रेयर. द नंबर इज हाई एज यू क्रॉस नर्मदा, बिकॉज पानी का प्रॉब्लम है. और जब पानी नहीं होता तो किसान के पास 40 एकड़ 50 एकड़ लैंड है, लेकिन उतना एकरेज भी वेस्ट हो जाता है क्योंकि उसके पास पानी की कमी है और वो टेक्नोलॉजी को इस्तेमाल कई बार करने में हेजिटेट करता है. गवर्नमेंट हैज दी पॉलिसी, अगर मेरे पास 30 एकड़ का खेत है उसमें 3 एकड़ में तालाब खोद लूं तो, बट यू हैव टू बी एंटरप्राइजिंग फॉर दैट, यू हैव टू बी इनोवेटिव. और हमारे देश के अंदर जो हमारा ये जो स्टाइल है और जो इंटरवेंशंस भी है, बिकॉज दादाजी क्या कहते हैं, पिताजी क्या कहते हैं, एवरीथिंग इज वेरी वेरी इंपॉर्टेंट. यू हैव टू ब्रेक दैट बैरियर, देन ओनली यू कैन डू समथिंग इनोवेटिव इफ यू हैव गॉट द फैमिली सपोर्ट. तो ये बहुत बड़ी चीज है. और उसके साथ एक बदलाव, एक हमारी सोच में बदलाव. हम आज भी ऐसा क्यों सोचते हैं कि किसान गांव में ही रहेगा तो खेती करेगा? हम ऐसा क्यों नहीं सोचते कि जो हमारे शहर के बाजू में जो छोटे सैटेलाइट टाउन्स आ रहे हैं उसके अंदर फ्लैट लेके एक गाड़ी, एक मारुति लेकर रहेगा अपनी बीवी के साथ और खेती करने के लिए खेत पे जाएगा, सुबह 8 घंटे काम करके वापस आएगा और फ्लैट पे रहेगा. क्योंकि जिस दिन हम ये मॉडर्नाइजेशन कर पाएंगे उस दिन हमारे देश की एग्रीकल्चर ज्यादा प्रॉफिटेबल हो पाएगी, ज्यादा अच्छी हो पाएगी. और जिस दिन हम सोचेंगे कि खेती कर रहा है तो गांव में ही रहना है, ये गरीब आदमी है, ये अनपढ़ आदमी है, ये शेड्यूल्ड कास्ट है, डिप्राइव्ड है, तब तक इंप्रूवमेंट नहीं आ पाएगी. दिस इज माय थॉट.
Right. Thank you so much, Mr. Aggarwal. Thank you so much. We are really at the end of time. We were actually 5 minutes over. on the second edition of the Coronavirus India Live Virtual Summit, which was brought to you by IHW Council with great partnership from Omnicuris. Thank you so much, Savitha, Kuttan, and the Omnicuris team for having helped put this together. What we have had is about 125 minutes of great conversation across multiple facets of the problem that is there in front of us. We titled this as Many Fronts, One Fight. What's the one fight? Is it the fight against a virus, or is it the fight against what we have as a collective situation where we are all stunned into both inaction and inappropriate action because a virus turned up? What we have is a problem of a large number of people right now staring at hunger, a large number of people potentially staring at a health situation brought on by a virus, but even more importantly, brought on by an inadequate healthcare system. So we have two things that are right now staring at our face. We have, to quote John F. Kennedy, a farmer is the one who buys everything in retail, sells everything in wholesale, and pays freight on both sides. We have large stocks of food grains, and we continue to think that we are subsidizing our farmers when we are unwilling to pay them their fair wages. In fact, the last picture that Mr. Aggarwal pointed out, if we can have farmers staying in flats as you and I are, and are able to put in an 8-hour work shift and be paid and have their own cars and securities, that would be a very different reality, and that we need to struggle with. The virus actually points out a situation that is something that we have ignored over decades, and we need to address that. And the other thing that it has pointed out is the fact that our healthcare system has a long way to go. We have underinvested in our public health system. And in many cases, we have looked at the private healthcare system both as a band-aid and also with great suspicion. Is this a moment where we are able to leapfrog both that band-aid mentality in healthcare and the suspicion that comes along with profit motives with better technology to say health of everyone matters? If we don't have a baseline health at the primary level, we will not be able to be resilient when a new virus comes along, which means diabetes is as primary a problem as somebody who has got a cancer. If we do not have good ways of eating at home, whether it's because of economic reasons or whether it's because of bad marketing, and we get into obesity or we get into disorders of nutrition, we are going to be as prone to a cardiac disease as much as to the consequent shock of an infection that comes along. We need to have a better way of training people. Training not for the degrees, training not for the skills that but training for the skills that they need to apply into situations when faced head on. I like the way Dr. Sachin Bajaj actually quoted Reid Hoffman. Entrepreneurs are people who build planes after having jumped off the cliff on their way down. That requires both skills and then the ability to problem solve as the problem hits you in the face. I don't think we have a university system and an education system that's giving us a generation of people who are problem solvers. We have a generation of people who have expectations of a job and of a livelihood without the skills or the perspectives of solving problems as they're happening. And so therefore, what does the coronavirus war or the coronavirus situation kind of point to us? That we need to pay attention to a large number of people, primary producers in our country, who have been shortchanged for the longest time. We have to figure out how their lives will matter as much as somebody else who stays in a city and works in an IT sector firm where the privileges to work from home. That's one bit. Second, we need to address ourselves to where our healthcare needs to be strengthened in a way that nobody will be left behind. And last, we've talked about demographic dividend. Everybody's used it over the last 10, 20 years. If we have to have a demographic dividend, we need to have a generation of problem solvers. Is it possible to do RT-PCRs in our BSc microbiology labs? Why not? That's a capacity. If we have got a birth cohort of 25 million kids and 18 million of them land up into a college, is there a way that we can get problem solvers out of that? And that hasn't really been the focus. And so therefore, Corona, these last 90 days, gives us both a multi-focus or multi-front war and also a multi-front solution framework. We need to solve it from the food perspective. We need to solve it from the healthcare perspective. We need to solve it from the education perspective. We need to solve it from a whole of society perspective. And that is what we at IHW Council, Integrated Health and Wellness Council, wants to bring partners and stakeholders to both talk and act. Conversation is cheap. Action is a lot more expensive and a whole different game. Thank you for joining us for this conversation. But I hope that we can continue to translate this into action. It's been my privilege to host you for this conversation over the last 131 minutes. Thank you all for those that joined us on Facebook Live, for all of our esteemed guests and panelists. Thank you for sharing of your wisdom, of your time, and of your knowledge.
Thank you.
It was a privilege to have you. Thank you very much.